understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Thank you for your participation. This is Sandy. She's a 29-year-old female that was admitted to the emergency room 2 days ago for symptoms of dyspnea and orthopnea for 2 or 3 days that were not relieved by her rescue inhalers. At home, she takes Combivent and albuterol. She reports she just takes the albuterol as a rescue inhaler once or twice a month, but she does take the Combivent 3 to 4 times a day. She does have a history of asthma, but no other past medical history that's significant. She is a smoker. She smokes 7 to 8 cigarettes a day, but she doesn't feel like this has an impact on her asthma. When she was admitted, they did do a chest x-ray that showed left lower infiltrates. They did cultures, but they're still awaiting the results of these. They did a CBC and a BMP, which were within normal limits with the exception of her BUN was elevated and her creatinine was elevated. Her BUN was 26 and creatinine was 1.8. Also, her white blood cell count was 10.2. So her doctor started her on Levaquin for treatment of pneumonia. Right now, I'm going to take a listen to your lungs. Warm this up a little bit. All right, take a few deep breaths in and out. Deep breaths in and out. You still hear some scattered bronchitis in the left lower lobes. How have your secretions been?
I'm so confident I have some like tannish color sputum.
Is it any better than it was before you were admitted to the hospital?
I think it's a little less.
A little less. Have you been up walking any?
Earlier today I walked around the nurse's station.
Okay. Have you been out to smoke since you've been here?
Yeah, I did go out this morning.
You have? Did you feel like your breathing got any labored after you smoked?
Just labored walking down there, just with the activity of walking down there.
Okay. What we might do is refer you to case management. They can give you some community resources for smoking cessation. They might want to do, I can also speak with your physician. They might want to do like a nicotine patch or Chantix or Wellbutrin. A lot of times people have good results with those. You don't have any history of depression?
Mm-hmm.
Okay, the reason I ask is a lot of times those medications are contraindicated if you have a history of depression.
Okay.
Is it something you might be interested in trying to do?
Yeah, I'd be willing to try
Okay. One minute, go ahead and squeeze my hand. Okay. How your bowels been moving okay? How often do you go to the bathroom?
About every day.
Any calf or leg pain?
No.
No? Let me check your pulses. Okay. You know, they're going to do your incentive spirometer every 1 to 2 hours while awake.
Okay.
Okay. And try to drink some fluids. That'll help also kind of loosen up those secretions so you can cough them up.
Okay.
Do you have any questions for me?
I don't think so.
Okay. Thank you.
Thank you.